According to the American Red Cross Association, the objective of CPR is to give effective chest compressions and ventilations to circulate oxygen-rich blood to the victim's brain and vital organs. CPR is 5 cycles of 30 compressions per cycle, followed by 2 ventilations or rescue breaths. To ensure that CPR is done properly, you need to make sure that the victim is on a firm and flat surface and that the chest compression rate and depth are correct. The rate should be 100 compressions per minute and the depth should be about 2 inches on an adult. Also, while giving ventilations, you need to make sure that you keep the head and the chin tilted up to ensure that the airway is clear, and while you're giving the breaths, you need to make sure that you're watching for the chest to rise to ensure that the breaths are going through. Make sure that you do not stop CPR unless you see visible signs that the victim's breathing or that an EMS personnel or another trained professional takes over for you. Also note that it's possible for the victim to vomit or for the ribs to break or the cartilage behind the sternum to separate, but that's normal and it shouldn't stop you from continuing to do CPR. When approaching a victim that seems to be unconscious, you need to make sure that you survey the entire scene around you to ensure the safety of yourself and the victim while giving CPR. Surveying the scene.
Scene is safe.
After you survey the scene, you need to make sure that you tap on the victim forcefully and ask them out loud if they're alright or if they're okay. After you do that and there's no response, you need to look someone in the eye directly and tell them to go call 911 to ensure that an EMS personnel will be on the way to take over for you. Are you alright? Are you okay? Victim is unresponsive. You go call 911. After you do that, you need to check, and that's why you hold up their neck and you have to make sure that their chin is raised and you listen for a breath. And that's why when I go to do this, I put my ear as close to their mouth as I can because you're trying to listen to see if they have a breath. You also have to check the pulse, which you go on the center of the neck and you slide down until you hit a groove, and that's where you're feeling for the pulse, and you need to make sure you do that while you're listening for them to breathe. If they're breathing but they don't have a pulse, that's when you know that you need to start CPR. Once you begin to do CPR, you need to make sure that your non-dominant hand is flat against the chest and that your dominant hand is in a fist on top of the other one. You need to make sure that you're in the middle of the chest. You need to make sure that your hands stay straight and that your arms stay perpendicular to the body. While you're doing the compressions, you need to make sure that you're doing 30 of them and that you're counting out loud while you're doing them, because you're going to need to do 5 cycles to complete one whole sequence of CPR. After you do 30 compressions, this is 1 cycle, you need to make sure that you're breathing twice into the mouth again, and you need to make sure that you're lifting the neck and the chin so that air can successfully go into the neck and through to the lungs. After every 5th cycle of CPR, you need to check for breathing and a pulse again. If there's still a pulse but no breathing, you need to continue doing CPR until an EMS can come and take over for you. And now I'll perform a cycle of CPR without any interruption. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.